I had the privilege of visiting our projects in Sanjo in Malawi and Beira in Mozambique last month, and I was really actually shocked that people still got sick to the levels that I was able to see that people were really actually sick. I think in Beira, I was at the hospital when within the next 2 hours, a patient who had come in very sick and was in the emergency ward was actually diagnosed and put on treatment. It made me understand the value of time in terms of diagnostics and quickly putting people on treatment as they come in very sick and at risk of losing their lives. We see many patients, or rather people living with HIV, coming into the hospital very sick, and upon diagnostics are found to have advanced HIV. So there are people who were previously diagnosed, have been taking their treatment just okay, or there are people who were HIV positive, diagnosed, and had been put on treatment, and then along the way they stopped taking the treatment or they dropped out of care. What I also found very inspirational from the Nsanje Clinic was this community peer educator who had just undergone some training and mentorship, and in a very small room was able to see peers who had been identified as ill, but also to see that there are avenues to address, quickly diagnose and treat people who are very sick. Was actually testing for CD4s and then doing the LAM and the CRAG to test for TB and to test for cryptococcal meningitis, to ensure that these services are available at primary healthcare level, where most of the people will get to first before they get to any other level of healthcare. People don't have to walk long distances, don't have to wait for when they will have enough money to get to the big hospital. Right at the primary healthcare setting, these diagnostics tool and treatment can be made available there for people to see them. Yeah.